Northamptonshire who was diagnosed with bladder cancer 2 years ago says she's now free from the disease because it was spotted early.
Geraldine Sinfield noticed blood in her urine, one of the key symptoms for both bladder and kidney cancer, which causes more than 7,000 deaths every year.
Well, now Public Health England has relaunched its Be Clear on Cancer campaign, which highlights the early signs, as Emily Knight now reports.
Yeah. Oh, I don't know. Maybe it's because I'm getting older.
Well, there's got to be a logical explanation.
Well, maybe it's just a one-off.
A simple message in the fight against kidney and bladder cancer. Today, Public Health England is relaunching its campaign, promoting the importance of early detection. Geraldine Sinfield from Polbrook near Peterborough has been free of bladder cancer for 2 years. In December 2013, the 68-year-old noticed blood in her urine and went to the doctors straight away. She had the beginnings of a tumour and was operated on the next month.
I couldn't have left it. That didn't enter into my thinking at all. There's more of it. I've got to find out what this is. It's obviously not normal, and I was very, very fortunate that it was in such an early stage. It had literally just broken through the wall of the bladder, and they operated so quickly. You know, if I'd have left it, what would have happened then? If I'd just ignored those signs, would have been bad, because there probably wouldn't have been any more. I think that's the vital thing, that there probably isn't. You'll just get that one opportunity.
Did you know that blood in pee is a key symptom for both bladder and kidney cancer?
Just under 17,500 people are diagnosed every year in England with one of these two cancers, but there are more than 7,000 deaths as a result, which is just over 40%. In our region, the picture is similar. In 2013, there were 29 deaths in Milton Keynes, rising to 150 in Hertfordshire. Nikhil Vasdev is a urologist at the Lister Hospital in Welwyn Garden City and says that early diagnosis can greatly reduce those numbers.
The cancer of the kidney or bladder, if it's confined to the kidney or bladder itself at the time of diagnosis, at the end of 5 years, approximately 80% of patients will be alive. Whereas in kidney or bladder cancer, if the cancer spreads outside the kidney or the bladder to the adjacent organs, the survival drops down to about 10%.
When this campaign first ran in 2013, 18% more people visited their GP with symptoms. Bladder and kidney diagnoses went up by 22%, and experts believe this saved 90 lives. Now Geraldine and her husband Alan are able to look to a brighter future, knowing she is cancer-free. Geraldine will need a check-up every year for the next 10 years, but is only too aware of how things could have been very different. Emily Knight, ITV News, Polbrook near Peterborough.